Okay, is everybody on? Okay, good evening and thank you for joining us for the City of Lubbock news conference. Tonight we're going to bring you the latest developments of COVID-19 in the community. After we hear from our speakers, we will allow the media partners to ask questions, but please use the raise your hand feature and I will patch your audio in so you can ask your question. But let's get started with Director of Public Health, Katherine Wells.
Good evening, and thank you for allowing me to update our residents once again with regard to the COVID-19 situation here in Lubbock. Before I begin this update, I want to again assure our residents that the health department is working with our hospitals, doctors, healthcare providers, as well as state health officials to ensure everyone has the most recent information and guidance as we continue to move forward. With this in mind, we want the public to continue to stay at home, follow good hygiene practices, and when you must go outside or visit stores, practice social distancing. And the most important thing is if you're sick, stay home. I know it is hard to stay home when you're sick, but this step is critical to keeping the community healthy. The city is going to get through all of this, but we need every resident to take responsibility to help prevent further spread of coronavirus. Today we are reporting 191 cases in Lubbock County, and we have not reported any new deaths today. We are remaining at 6 deceased individuals. Called the department today asking what recovered means. And there's a few different ways to determine if someone is recovered. The first method is a test-based method. This means that the individual has 2 negative COVID-19 tests at least 24 hours apart. This method is preferred for hospitalized patients, and we're also using it on individuals who are in a nursing home, long-term care facility. The second method is one where we're watching for symptoms. And in order to be considered recovered, you have to have at least 7 days since symptoms started, plus at least 3 days without symptoms. So the quickest anyone can be considered recovered is 7 days. And we are seeing people that are taking much longer to be recovered. Health department staff are calling our different individuals under monitoring every couple of days to check on them and make sure and see when their symptoms subside. If somebody is recovered and they're returning to a healthcare job, they must wear a mask, and there are also restrictions on what individuals they can work with. The health department is also working on multiple investigations in local long-term care facilities. There are over 100 cases associated with nursing homes right now. This is our community's most vulnerable population, and any case associated with these homes is considered an outbreak. These investigations take time, but it's critical that we identify the spread of disease and work with facilities to isolate individuals. As soon as a case is identified in any of these high-risk facilities, we've been working with UMC and other nurses and doctors in the community to get individuals tested as quickly as possible and getting those test results, and then working to isolate any individuals in the facility who may be sick. Our investigations are also starting to show more community spread. Community spread is the term that is used when there is no known exposure to the virus. This means that an individual from the health department contacted the individual that tested positive. We've gone through all of their contacts, and we've been unable to identify somebody in their social network who is also positive. Community exposure is expected as this epidemic progresses, but it also means that everybody needs to continue with the measures set in place at locally and at the state level to prevent others to be exposed. That concludes my data report, and I'm going to go ahead and pass that on over to Dr. Cook. Thank you.
Thank you, Katherine. Let me just say right off the bat that I think most people in Lubbock are doing a very, very good job. I was at the grocery store the other day and they had lines on the floor and said to stay 2 grocery carts away from the next person. There were marks on the floor. They had sneeze guards in front of me, between me and the cashier. They had covers over the cash register where you put your credit card in. I saw people, I was trying to get some bananas and I saw people just patiently waiting on each other, not getting too close, to take turns. And I was just really impressed with the way people were acting at the grocery store. And I just want to commend everybody that is doing their best to try to abide by this social distancing. There's a term that we use in the hospital. It's called alarm fatigue. So this word alarm fatigue means if you've ever been in an intensive care unit, you notice how noisy it is. There's alarms that go off for the heart rate. There's alarms that go off for your pulse. There's alarms that go off for the oxygen level. There's alarms that go off for the IV and alarms that go off for the ventilators. And so in those cases, just alarms, it's just a cacophony, a loud set of noises all the time. And that's just maybe for one patient. And those of us that have worked in the ICU before, we kind of get used to hearing that, where we don't hear the alarms anymore. I say that because we have very good nurses. I don't want you to worry that we're ignoring things. What I want you to hear about the word alarm fatigue is you hear from us on this side of the fence talking about wash your hands, wear a mask, social distancing, stay home if you're sick, don't go out, stay away from other people, and don't leave the house unless you really need to. You've heard me say this, and you've heard Katherine, and you've heard the mayor, you've heard all of us say this over and over. I don't want you to get alarm fatigue from listening to me saying those things. I have a very dear friend that teaches communications at Texas Tech. He's a professor there, and he says, I heard you the first time I listened. I want you to listen to us every time, because I don't want this virus to spread. And the way we do this and the way we flatten the curve is to make sure that we do all these things. And I know that you may be tired of hearing that's not anything new. I'm not saying anything new there, but I need you to listen and heed to those recommendations. So the next thing I want to talk about is facial coverings again. I showed you this one. Somebody said I look like Dr. Indiana Jones last time I had this on with my hat. These facial coverings, so the new CDC guidelines now actually recommend that everybody who leaves the house should have on a facial covering. I'm not going to call it a surgical mask. Surgical mask for those individuals that are taking care of ill patients in the hospital. This is a facial covering. It's made out of at least a couple of layers of tightly woven material. And remember, I said, don't take your grandmother's tea towels. And they're worn tightly around the face where they're snug against the cheek so air doesn't leak beside you. And these are mainly for individuals to wear to protect so they won't give the virus to somebody else. And you might remember last time I talked about individuals can be asymptomatic and shed the virus. In other words, I could be shedding the virus and I not even have any symptoms yet. So this is for me, if I might be shedding virus, that I wear this so I don't spread the virus to somebody else. That's primarily what this is for. And because we do have asymptomatic individuals, you may not know that you're shedding the virus. And that's how we get community spread. So when you leave the house, I need you to wear one of these, because the CDC says it probably does help in slow community spread of the virus. There's a couple of people, a couple of patient populations that shouldn't wear these. So very young, probably less than 2 years of age, shouldn't wear a mask on their face because they don't have the ability to pull it off. If they were to get sick at their stomach, they wouldn't have the ability to pull it off. The other individual that shouldn't wear these, somebody who has some kind of neuromuscular disorder where they don't have the muscle strength to reach up. Somebody's had a stroke or somebody like that that can't remove the mask from their face. Those two types of individuals probably shouldn't be wearing masks, okay? So what I want you to hear is wear your mask. I want you to stay home. I don't want you to go out if you're sick. And I want you to continue the social distancing and make sure you stay away from other individuals. Most people are doing a great job at this. Now, when I went to the grocery store the other day, I didn't wear this. I'm a little self-conscious. I can certainly wear a surgical mask in the hospital. I'm quite used to doing that. I do that all the time. I'm a little self-conscious about wearing this when I go outside. So from now on, I'm going to wear this because I'm asking you to do that. So I'm going to do it too. I'm going to have to get over my self-conscious and not be embarrassed to wear this, because what I want to happen is we don't spread this virus, because in the long run, what we're trying to do is flatten the curve so that we have enough hospital beds and enough ICU beds that when I do get sick, if and when I do get sick, that I have a place to go. I have a bed to be in, and if I need to be in the ICU, I have a bed available, because we flattened the curve and we've not gone over that threshold where we run out of beds and we run out of personal protective equipment and we run out of ventilators. I need you to do this for me, and I will do it for you. I'm going to wear my mask the next time I'm out. That's all that I have. Thanks for listening. And one final comment, it says, I heard you the first time I listened. I want you to listen. Thank you for your time tonight. That's all I have. Mayor Pope?
Good evening. It's been several weeks since several days since we last talked, and I want to make sure that I start by talking about the number of cases we have. The question I keep getting is, does that concern you? And so let me start by saying our testing is working. We are fortunate to be able to have the hospital-based testing as well as UMC's drive-in testing, and as of yesterday, Covenant's drive-in testing. In fact, if you live in Lubbock County, your chances of having been tested, and we've tested more than two times as many residents per capita as the rest of the state. So that's good news, because testing allows us to identify where the sick people are. Then we want to isolate them. Remember that only about in Lubbock, the people in our 190 cases, let's go with that, but even statewide, a little less than 15% of those positive cases end up in the hospital. The vast majority end up in their bedroom, like you and I do when we have the flu, drinking Gatorade and eating chicken soup, I think is how Dr. Cook recently described that. So the testing is positive, and we ID the sick, we isolate them. If we're doing that while at the same time staying at home to slow down the spread, we win. Our hospitals remain strong. As of early today, we had 29 positive cases in UMC and Covenant. Only 10 of those were in the ICU. So well more than 100, I think north of 140 ventilators available. So we remain strong, and that's where we need to stay. We flatten the curve. We keep our hospitals strong because we want to come out of this as quick as we can. I want to do a couple thank yous. I want to thank some of our grocery stores and big box folks for their leadership. Let's start with grocery stores. United Supermarkets, Walmart, Sprouts, they've all done different things to make sure, to make certain that, and those are the three that came off the top of my head. It's not a comprehensive list, but those are they've done things to make their stores safer. They've spread us out, as Dr. Cook talked about. They've posted a lot of signage. They've put up the spit guards. They've guarded the touch pads that we use. They're cleaning after every after every guest is in their store. They're limiting occupancy. That's fabulous. When you couple that with what's going on at Target and Costco and Cabela's, to name a few, we're really getting there. And so I think that's positive, because this is not going to go away tomorrow. And we need to establish these unusual habits so we keep people safe. We're going to, we've published retail guidance from the health department. It's what we expect our retailers to use, and they've done a great job of that. We're taking a stronger look at I think what they call neighborhood service stores. That's your dollar stores and convenience stores. We're going to look again at those and update our guidance for those folks. I'm not sure that we've had quite as much change of behavior there, and it's something that is very important for our citizens, and that might even include some occupancy limits, the same kind of things that have happened in our larger stores. Okay, so as I start to wrap up, I was on the phone this afternoon with Governor Abbott for a couple hours, and he was on with mayors and county judges from around the state. And I think it's maybe best that I start by saying what he said, repeating what he said. He said the next 3 weeks are critical as we stay home and slow the spread of this virus so we can begin to talk about recovery. So we're just 3 weeks and a day or two from April 30th. I think that's the message. Now, good weather, our general impatience, and maybe a little bit of our West Texas entrepreneurial spirit, gives us this urge to go back to work. And I know that's very difficult, but I implore you to sacrifice. It's a short-term sacrifice for, I believe, a faster, fuller recovery. Our job, I think, is to balance public safety and the long-term viability of our community. We'll continue to make decisions that are fact-based, using common sense and the very best information we have at the time. Don't forget the big three. Wash your hands, don't touch your face, and keep your distance. Please be well, be kind, and be hopeful. Thank you very much.
Okay, we already have some media members wanting to ask some questions, so I will tell them via audio that they've been patched in. And I saw Karen McKay first. Well, I don't know what happened to her hand. So we'll start with Terry. Terry?
Yes. Can you hear me?
Yes.
Hi, Terry.
Hello, everyone. Terry Furman with KLBK. I wanted to ask, we're seeing a lot of things for people planning on the Easter holiday. I realize this is a big holiday, a lot of family get-togethers. What do you want to say to folks that are considering, going to the park and celebrating together?
Ron, why don't you start?
These are difficult decisions and difficult things to do and try to make plans. It's social distancing. It should occur even though it's a holiday. And I know that that's hard, but we can't afford, our hospital beds right now, we're doing just fine on hospital beds. But if we get too lackadaisical, that's why I said about this alarm fatigue. If we get too lackadaisical on our social distancing and making sure we stay away from each other, then we're going to see a takeoff in the number of community spread. And I know it's Easter, and I like Easter just as much as anybody else, but we just can't do it. If we can hang on for a couple of months to push this down and push this out, we're going to be fine. but we just can't afford to make the spread of the virus worse by having big parties. I'd strongly recommend it not doing it.
Terry, I want to add to that. Our churches have been fantastic. I mean, this is Super Bowl Sunday for our churches, and they've found a way to adapt. And we're doing virtual services. Some are doing drive up, parking lot services, and still following our order and doing the social distancing. We're going to have to do Easter different this year. Let's do a virtual Easter. I'm on what's now become a weekly distributed virtual family gathering tonight at 7:30. I have another one on Thursday evening with a bunch of my college buddies. We need to do things differently. We've got to sacrifice for the short term, and that means Easter.
Can you hear me?
Yes.
Sorry about that. We got, this is Matthew Still with KMAC. We got a viewer who messaged us and said they believe that the Stripes employee is the same person who works at the O'Reilly distribution plant. Is that true? Can somebody confirm that for us?
Ms. Wells, you want to talk about that? You're muted, Katherine.
Thank you, Mayor. We have multiple investigations going on with lots of different individuals. Whenever we determine that there is a community exposure, we're moving ahead and working to make those announcements. Through those investigations, we look at where employees were in a facility, their interaction with the community, and we're really concentrating on when there's exposure between a sick individual that's at a workplace and there's lots of community members coming in. And that's what has us make that announcement. Lacey, you're muted.
Our next question is Christy Martinez. Christy?
Good evening, everybody. Christy Martinez Garcia with Latino Lubbock Magazine. And my question is there a new protocol for people that have died naturally or to other health issues requiring them to have the COVID testing? And would this practice be done as part of an autopsy?
I'm happy to talk about that, Christy. Thank you for that question. I don't know of any particular requirement for the testing for an individual who works at a funeral home before they embalm the body or something like that. There is a state licensing entity that for morticians, and they should check their licensing institution or entity for that requirement, but I'm not aware of any.
Next question is from Adon Rubio. Adon? Hang on.
Hi, everyone. I'm Adon Rubio from the Daily Torador newspaper at Texas Tech. And this question may be for Dr. Cook. And I was just wondering, at what point during the recovery process do symptoms start subsiding? And can someone still be asymptomatic after they have recovered? Thank you.
So the first part of the question, it varies between different individuals. How severe was their illness? Maybe they just had a little cough and felt bad for a few days, and then they got better. The other scenario is somebody that was feeling poorly about day 8, they had to go to the hospital, then the next day they're in the ICU, and then they had 5 or 6 days or 7 days in the hospital. After that, I think some of the studies talk about a 22-day or so or 25-day stay in the hospital. So that individual is not like the individual that just got the sniffles and got over it. What we don't know exactly for sure is how long someone is infective after they leave the hospital. That's why we recommend, in most cases, a 14-day isolation even after they're discharged from the hospital, in most cases. we know that some people continue to shed virus after they're discharged, but we don't know if that virus or viral particles are infectious. So we're still working on that. And this stuff changes every day. We get stuff from the CDC, we get reports out of Washington State, we get reports out of New York, because they're further along in the disease process than we are. So these things change daily, just like wearing masks. Initially said you shouldn't wear a mask. Now we're saying you should wear a mask. So these things change on a daily basis. I hope that answered your question, Aiden.
Okay, and now we have Karen McKay. Karen? Karen? I can't get it. We'll come back to Karen. So we'll go to Christy Martinez Garcia. Christy?
Yes, at the direction of Governor Abbott today, can you hear me?
Yes.
Sorry about that. At the direction of Governor Abbott today, he temporarily called for state parks to be closed. And there's some concerns from our viewers that the public is not practicing on golf courses and at parks. What are the plans as far as temporarily closing the golf courses and the parks, if any?
We don't have any plans to make those moves right now. We have and will continue to visit parks and golf courses to inspect and make sure that people are following the social distancing and following the order that is in place. But we think it's good for people to be outside, and that continues to be our stance.
Go to Karen McKay.
Okay, can you hear me now?
We got you.
Yay! Dr. Cook, will you explain, how can you choose which people to test if they're asymptomatic?
So some of that is just absolutely a judgment call. It usually may mean testing people that are in close proximity to each other, say in a nursing home. We've done some purposeful testing of individuals to see if they were tested positive or tested negative and not have any symptoms. And then those people we would try to separate, so they're positive. So we'll keep those with the positive people and separate the negative people completely away from the other people, so they don't infect it. So these people that are positive don't infect anybody else. If the best case scenario is that we had unlimited testing and we could test everybody, little hot spots around the city, to find out where there's carriers that are asymptomatic, so we could isolate them and put them in isolation so they don't infect anybody else. We just don't have that capability yet. It's coming as these new tests come online, as these new tests that are antibody tests that can be, the results can be determined in 15 minutes or so. That will help us. But until then, we're trying to find out in those small pockets of where the infection is, who's positive and who's negative, so we can separate those so they don't get anybody else infected.
But sir, can I ask you, can you hear me still?
Yes, ma'am.
Can you hear me, Dr. Cook?
Yes.
Tell me, but let's say I went into that Stripes and I knew that I frequent that Stripes where it's an exposure site now. Does that mean I don't have symptoms, but maybe I should get checked because I know I go into that place?
It would have to depend on your exposure time and how close you were in that individual, and was that individual spreading the virus then? In other words, were they working when they were sick? And this is the whole thing. If you're sick, you need to stay home and not go to work. I know that's a fiscal burden, but if you're sick, you really need to stay home so we don't spread it. For the most part, no, you don't. It's such a short exposure time. But ideally what we do, you wash your hands when you leave there or before you leave. You don't touch things as little as possible, and you do things to protect yourself, and wear your mask, Karen, so the next time I see you, I want to see your mask.
Next we have Matt Dotre. Matt? Matt? Okay, we'll come back to him. Okay. Christy Martinez Garcia.
Catherine, we talked a little bit earlier about the protocol for having someone that has passed away naturally, having the COVID testing, but we actually had a call today from one of our readers, and that was their concern that their family member that is, passed away and they had a fall. And then when they went to the hospital, they were told that before they could be buried, they passed away obviously, before they could be buried, they would have to have COVID testing. So that was very confusing for them. And it's also, not a practice of their religious beliefs. So there's a lot of concern about that from this family. And right now the body is in limbo, and this funeral home is requiring that COVID test be done before they can actually follow and pursue. So, can you answer that a little bit for us? I've looked it up and I can't find the proper information.
I can help with that, Christy, a little bit. I would go back to my original answer. They need to check. I'd ask the family to check with the state anatomical board. The state anatomical board is the licensing entity for the mortuary or the funeral home. And so they need to vet that through the state anatomical board.
Okay, we're gonna try Matt Dotre again.
Can you hear me now?
Yes.
Okay, good. Sorry. Katherine, those 100 cases with nursing homes, are they all at Whisperwood, or has there been another nursing home where someone tested positive?
We're currently investigating multiple facilities that have residents that are positive with COVID. Whisperwood continues to have the largest number of cases.
We have 3 hands raised. I'll ask these and that will be the end of our questions. Let's start with Matt Stell. Matt?
Hey, Lacey, thanks again. Kind of picking back on the nursing home, we saw that the state released a guidance for nursing homes and long-term care facilities. It's 28 pages, walks through everything as it relates to employees. If employees has contracted COVID-19, what they should do, what the nursing home should do, isolation practices. Is the health department seeing that guidance? This is more probably for Katherine. Has the health department seen that guidance? And are the local nursing homes and long-term care facilities expected to follow that guidance?
Yes, we have reviewed that guidance, and the guidance that was provided is very similar to what we issued through our quarantine orders and the guidance that we were providing about 2 weeks ago to our nursing homes. That information's been distributed to the nursing homes, and their compliance with that is facilitated by both the health department and Texas Health and Human Services.
Terry?
Yes, ma'am. One more question. We've had several folks ask us about if their jobs are still going at certain places, but their job is not essential to be in the building. Do you recommend that those people request to work from home, or what their bosses say and they should all come in and not practice the social distancing?
So we're not going to tell businesses where people have to work. We've encouraged any job that can be moved to home that happen as quickly as possible. And I'll give you some examples. We have a number of our CPA firms and law firms and insurance firms where they've been able to investment firms where they've completely moved people home. Some have even closed their offices, just go by to pick up mail. So that's what we would like to see. There are a number of our central businesses and job types that you can't work from home. Let's take construction for a minute, or healthcare, or delivering food, or working in the grocery store. So I think if an employee feels like they can work from home, they need to talk to their boss, but they don't need to talk to me about it. I really don't, I don't have a role in that.
And last question will be Karen.
Better on their own, and that's really what we're seeing here. From nursing homes, I showed you the graph a moment ago, 99 of the cases so far have been connected to nursing homes. That's what we don't want to happen, because of course they are the most vulnerable. So if you feel sick at all, even allergies, advised, stay at home, nurse your cold or whatever.
Okay.
Okay.
Okay, that's all our time for tonight. We will be bringing you the latest updates on our social media channels and through news releases. So thank you all again for joining us.